Hi, welcome everyone. Welcome to the sixth training module of Diversey series on infection prevention. My name is Claire Khosravi and I'm the infection prevention application expert for Europe. And today we'll talk about a specific product, our pre-wetted cleaner disinfectant wipe. So I will share my screen in a minute and then we can start. So as I said, the topic of this training module is the pre-wetted cleaner disinfection wipe. But first, I'm going to tell you a bit more about myself. I have a doctoral degree in microbiology and molecular biology. I'm responsible for our professional level range of disinfectants for the infection prevention portfolio. I provide consultation on diverse topics such as microbiology, application of our EN testing, medical devices, and I deliver training program for our sales, marketing, technical managers, and application specialists at a European level. So in the agenda, we went through already five different training modules, and today we will talk exclusively on a specific OXIVIR product, which are the wipe. But before to start, let's have a look at this picture. It's from global source from Artisan, and they have done a market study globally and also at a European level, where you can see from 2019 to 2020 the incremental growth opportunity for the disinfection wipe. So we can see that the behavior are changing of the users. And if we look at the European level, where you can see the spray and the wipe market in Europe from 2019 to 2025, we can really see that we are expecting these changes of behavior from bucket application to more ready-to-use wipe within Europe. But how is it organized between the sectors? So of course we see that the most important part it's with the residential sectors, followed by the healthcare, commercial spaces, hospitality, and government organization within Europe. And also in the literature, we have seen that many more studies are focusing on the benefits of the ready-to-use disinfection wipe. Here it's a study from Timothy Wicken, where they have analyzed that an increased cleaning compliance by 35% while using disinfection wipe, and a reduced time required to clean a patient room by 23%. And that's also yielded a cost saving on 30 euros per employee over traditional methods with a towel and bucket. Another study where they have used a pre-impregnated disinfection wipe, and they have shown that this is one of the most efficient and prevalent methods for the decontamination of high-touch surfaces and non-critical medical devices in a hospital and other healthcare centers. So there is indeed evidence to support that the disinfecting wipe is effective in preventing cross-contamination and the spread of healthcare-associated infection. So from the studies, there are several variables, of course, that influence the disinfection efficacy of the pre-impregnated disinfection wipe, beside the external factors. So of course, the disinfectant, the type and the concentration, the wipe, which material, the interaction, the application method, which is very easy, the wiping strategy, including the mechanical action with the applied pressure force over a surface area, and the storage time. And here we see another study on quad binding. So this study showed the impact on efficacy of Staphylococcus aureus on a different chemistries. So chlorine, quad, improved hydrogen peroxide, and a neutral cleaner, and different wiping cloth substrate. So non-woven, disposable, cotton, and microfiber on Formica. And key findings, so the improved hydrogen peroxide and chlorine were the best performing chemistry with 4 lower addition. However, quad was the worst performing product and did not outperform neutral cleaner in efficacy. So quiet binding is likely with cotton cloth, removing 1.5 log, so less than quad with microfiber in this test. And the cleaning ability of the microfiber helped make up for the quiet binding that affected the cotton cloth. So testing of the cloth and after wiping showed chlorine and improved hydrogen peroxide had the least leaf bacteria on the surface. And all the cloths with quad and neutral cleaner had significant number of live bacteria on the cloth after wiping, showing 2 to 3 log of bacteria surviving. So what is OXIVIR XL wipe? So of course, when we talk about OXIVIR XL wipe, we need to talk about the efficacy of this product, and it's effective against a broad range of pathogens, so including envelope and non-envelope viruses. It is fast acting with very fast contact time. We have talked in our previous training module about HP and the whole OXIVIR range. So I definitely invite you to also have a look at this training module if you haven't seen it already. It is safe because the HP is degraded into oxygen and water, and it's compatible for use on most common surfaces. It is gentle on the surfaces and sustainable. And here's a bit more detail on our OXIVIR XL wipe range that you can find in 2 different of packaging format, the flow wrap and the canister. And as I said, this OXIVIR XL wipe is corona effective. It's effective against bacteria, yeast, and viruses. It is BPR supported. It is compliant with the medical device directive. It has short contact time and it is safe to use. And then it falls under, as we discussed, 2 different regulations. So the MDD, soon to be MDR, and OXIVIR XL wipe is a cleaner disinfectant of non-invasive medical devices, but it is also a cleaner disinfectant of non-porous surfaces, which falls under the biocidal product regulation, the BPR. So the wipes are ready to use for faster disinfection. They are disposable wipe for ultra hygiene. They are convenient, so no preparation or laundry required. It's a powerful surfactant package that delivers really good cleaning performance, including descaling and lime limitation, a great safety profile to reduce worker risk, no hazard warning in dilution, and does not contain respiratory irritants. So this is a schematic picture of the efficacy of OXIVIR XL wipe, but we have also more detail and we can provide additional testing report from our accredited German laboratories who perform the testing according to the European norms. And what are the key benefits of OXIVIR XL wipe? So we have a full virucidal claim according to the EN 14476 in 30 seconds. Effective against bacteria, viruses, and yeast. It's easy to use by anyone, anytime, anywhere. HP is faster, safer, and sustainable, so there is no time needed to prepare and to use. There is no need of PPE. It improves the labor efficiency. It provides increased disinfection in the compliance because it prevents cross-contamination of surfaces, but also prevents the risk of wrong usage. It is not flammable because there is no alcohol. It is compatible with most hard surfaces, and it avoids the laundry clothes and eliminates the risk of a spillage. And sometimes we get a question, why using a wipe rather than spray or cloth? So on the left side, you have the pros of using wipe. So it's ready to use. It is efficacious and safe on equipment, completely disposable. And the wipe can be stored in a dispenser and it reduces incidents and the risk of wrong usage. The cons of using spraying, one of the first is the inhalation risk. It requires more time, so more action are needed. The disinfection needs to be diluted in the ready-to-use bottles and needs to be filled again. It is excessive spraying that can damage equipment and monitors. High consumption of paper. The RTU bottle are covered in micro because everyone is touching them, so it required an additional step of cleaning and disinfecting of the bottle, and the RTU and paper might be also wrongly used. Talking about wipe, we have our OXIVIR XL wipe, which is our daily cleaning and disinfecting wipes for every day. But then we also have our OXIVIR sporicide wipe, which is dedicated for task disinfectant and for outbreak, with a very fast contact time on bacteria, viruses, and also bacteria that produce spores, such as Clostridium difficile. So it's really had a superior safe profile, a broad range of efficacy that offers a highest level of patient protection. It is suitable for use in high-risk area, in healthcare, and no rinsing is required. And here you can find a market comparison here from 2020 and December 2020, where we have ranged several other products, where you can see on the left side our OXIVIR XL wipe, and you can see different colors, so green for best, orange or yellow for average, and red for bad performance. And the key properties, so the actives, the broad spectrum of efficacy, whether the product is fast acting, so has short contact time, whether the product remains wet on the surface, so that you can have a assured efficacy, whether it's a quad, so you have a risk of quad binding, cleaner, does it clean as well as it disinfects, surface compatibility, and non-toxic. So you can see that our Diversey OXIVIR XL wipe is really performing very well, and it has the full virucidal claim. So thank you for your attention. I would like to really thank you for following this sixth training module on the pre-wetted cleaner disinfection wipe. If you have any question, you can ask your Diversey representative, and I really invite you to follow the next training, which will be the last, on SARS-CoV-2 and the COVID-19 pandemic. Thank you very much for your attention.